Hi, I'm Jack Cush with Room Now. This is QD Clinic. QD Clinic is brought to you by Room Now Live, March 20 and 21. We've got a powerhouse faculty. Let me just read you the list. This is a sort of abbreviated list because I can't go on forever about this, but it's Roy Fleischman, Maya Book, Alan Matsumoto, Ian McGinnis, Frank Buderett, Clay Cockrell, Eric Ruderman, Alan Mentor, Alexis Ogden, Beth Jonas, Philip Robinson, Jeff Sparks, Nigel Haroon, Stanley Cohen, Lou Bridges, Artie Kavanaugh, myself, and there's more. Michelle Petrie. I'm leaving out a bunch. Check out the program. It's on roomnow.live. Today's case is, again, arthritis and colitis. We talked about this last week. Got another one that I thought was interesting and worth teeing up. This is a 57-year-old woman who's had a 10-year history of seropositive rheumatoid arthritis. Really seropositive, meaning CCP greater than 250, RF 200, high acute phase reactance polyarthritis. She's been treated over the last 10 years with a bunch of DMARDs, methotrexate, plaquenil, low-dose prednisone, escalated then to one TNF inhibitor, then another one. She was on those for a long time. That was stopped for lack of efficacy about 2 years ago, and she was put on abatacept and did really, really well. Her arthritis has been doing fabulous. However, about a year ago, 9 months ago, she started coming down with abdominal pain, bloody diarrhea, 30 pounds of weight loss, had a colonoscopy, was diagnosed with ulcerative colitis. So in the last 6 months or so, she's been treated with mesalamine and budesonide and was on azathioprine. And she stays on her RA meds, which is just Orencia, and she's not doing well. She's still having bloody diarrhea, and they're going to have to change her. The question is, what can you use to manage both conditions? Another question is, what's the deal with arthritis and colitis? Is there an association? Well, actually, I spent a little time on the internet looking at this, and we do see patients with colitis and rheumatoid arthritis, although usually it's a toss-up as to whether this is seronegative RA really masquerading as, or actually enteropathic arthritis masquerading as seronegative rheumatoid arthritis. And the same can be said for of the enteropathic causes, whether it's colitis, Crohn's colitis, or ulcerative colitis. So we have a lot of patients who are in that ballpark. And yes, if you control their colitis, then you should be able to control their rheumatoid arthritis. And unlike last week's case, in this case, the patient's colitis is out of control, but her RA is doing great, suggesting that this is probably not enteropathic arthritis, that these are probably two separate and distinct diagnoses. Maybe also backed up by the fact that she has very high seropositivity, attesting to the fact that this is rheumatoid in origin. The question then is, what can you use that would manage both conditions? Certainly, maybe methotrexate, sulfasalazine, azathioprine, those steroids, those might work. Of our newer agents and biologics, really, it's the TNF inhibitors. I'm not sure why they have not used a TNF inhibitor, and it's interesting to note that she was on TNF inhibitors for probably 6-7 years, and when she went off of TNF inhibitors is when she developed her colitis. Maybe the TNF inhibitors were working to treat the arthritis and the colitis, but when it stopped working on her arthritis, we took her off that. Now the colitis blooms. That's just a hypothesis of mine. But in addition to TNF inhibitors, now the JAK inhibitors seem to be very effective, at least in ulcerative colitis, not so much in Crohn's. So that's what's going to happen in this patient. She'll probably be switched over from the abatacept, which is controlling arthritis, not the colitis, and be put on high-dose JAK inhibitor, tofacitinib, and then maybe she can get down to a standard dose of 11 milligrams a day. Again, an interesting scenario, a tough case to manage because her arthritis is doing so well, but GI is looking to rheumatology for guidance, and of course, we told them the JAK inhibitor would be perfectly fine with us. Tune in for more QD Clinics tomorrow.